cholesterol is a really, really fundamental part of our body, and we can't be alive without cholesterol. Every cell in our body has cholesterol within the membrane. It's like the Glad wrap sort of envelope that encases the whole cell. It's a critical component of this, and it's also a critical component of a lot of the parts inside the cell as well. So cholesterol, I think the starting point, rather than demonizing it, is to realize that without it, we're not alive. We're not even here. We need to really respect its primary role in health. A lot of hormones are made by cholesterol. Many different elements of our body have that as a building block. So that's the starting point. Now, I need to recognize that if you go to a build-up, a plaque inside an artery wall, there is cholesterol there. And so we need to recognize that what ultimately leads to heart attack, the plaque build-up, does contain this thing. But I actually think that blaming cholesterol is a bit like blaming a firefighter for a fire, right? Because every time you go to the fire, you could say, I saw you there at the last fire, you did this. And that's not really blaming the right person. We should be thinking, well, what started the fire? And the reality is that cholesterol, one of its roles is as a plug or a band-aid. And the question that we really should be asking is that if we're finding cholesterol in the plaque of an artery wall, we should be saying, well, what caused the artery wall to kind of bubble away? What caused the inflammation in the artery wall to start with that led to the cholesterol to be needed to kind of put a plug in there and actually put out the fire, band-aid that bubbling away. And that's where all the other elements of health come in. Things that inflame our body, they're the things that we really need to focus on. We need to de-inflame ourselves. And that list is pretty extensive, but it includes things including insulin resistance. It's a really inflammatory state. And particularly type 2 diabetes is a really inflammatory state. So having a high blood glucose, that inflames the body and kind of poisons the body, really, leading to this inflammation. And then certainly, people with type 2 diabetes are way higher at risk in terms of developing things like heart attack. But rather than blaming the firefighter for the fire, so rather than blaming the cholesterol, which is just doing its job, just like the firefighter, it's trying to put the fire out. I think we should be saying, hang on, what started this? And let's see if we can reverse some of these inflammatory elements, such as type 2 diabetes. So to answer your question, is it dangerous to eat cholesterol? No, we know that when people restrict cholesterol in their diet, their body actually makes up the shortfall. Okay, so that's how important it is, that if you don't get it in your food, your body says, whoa, we need this. Let's actually make up the difference. Equally, we know if people eat a lot of cholesterol, their body just doesn't make as much. So your body really knows, and it knows what it needs. And I think, we certainly shouldn't be afraid of it. And I don't think we need to count the cholesterol that we're consuming, because our body's going to regulate that.